kinds of issues and trends that are happening in healthcare that give us the ideas of how to teach and what to teach to the students, such as what kinds of disorders are out there now that we have to make sure students are aware of and how to take care of them. And what's happening with RNs, what is happening with the workforce. I'm so glad that Michelle Obama is with us. Nurses, she says, are on the front line of healthcare delivery. They determine the quality of care received by all of us. And nurses are the majority of healthcare providers. And so they do provide all the care for us. The leading causes of death, I want to go over, just because these are the leading causes of disease. Cardiac disease, as we all know, which is heart attack and arterial sclerosis and stroke. Cancer is number 2. Chronic lower respiratory diseases, usually from smoking, is number 3. Stroke really should be up there as one of the cardiac diseases. 5 are accidents. 6 is Alzheimer's disease, which is becoming more and more prevalent as our population ages. And diabetes. Everyone is aware that diabetes is in epidemic proportions in our society, and we have to remember what are the side effects or complications that come from diabetes. Diabetes is a disease that will affect your heart. It will affect your kidneys. It will affect all over your body, so that we see amputations with diabetes. We even see blindness with diabetes. So that is one of the diseases that we talk about a lot, and all the disorders that go with that. Renal failure or kidney failure, influenza and pneumonia, and suicide. Heart disease, cancer, and stroke account for more than 50% of all deaths each year. 7 out of 10 deaths among Americans each year are from chronic diseases. We're seeing that people are living longer, however, they have chronic diseases to deal with as they live longer. Almost 1 out of every 2 adults has at least one chronic illness. The number of adults with diabetes is projected to triple by the year 2050. And so you know, as I said, all the complications that come with diabetes will triple by the year 2050. And the aging of the population. As you know, our baby boomer generation is aging, and we're coming upon a very large contingent of people who would be considered elderly. The aging of the population. Elderly presently are 14% of the population, and by 2050, this number will rise to 20% of the population. What's amazing is the majority are going to be over age 85. I heard on the news the other night that the oldest living American was 115, and they were just celebrating his birthday. And we're seeing more and more of people who are living over 100. 50% of those over 85 require daily assistance with health maintenance needs. And so that's why we're teaching our nursing students to not only work in a clinical environment, but they're going to have to learn how to work in the home health care environment as well. Currently, 1 in 8 older adults has Alzheimer's disease. With the aging of the population, we'll see 3 times as many patients with dementia by the year 2050. While only approximately 15% of the United States population is over 65 years of age, this group accounts for more than 30% of all the medication consumed. And we're seeing more and more prescription medications consumed. And we don't know why. The average geriatric patient takes anywhere between 2 to 6 prescription medications and 1 to 3 non-prescription medications daily. The percentage of adults that are taking 5 or more prescription medications nearly doubled between the year 2004 and 2008. And that statistic is puzzling. We don't know why that is happening, why more and more people are taking more and more prescription medications, but it does affect how we will teach our nurses in the future. Hospitals are increasingly becoming large intensive care units. When you go downstairs and you see the laboratory downstairs, it's really just as impressive or complex as a large intensive care unit. And we teach students in there because of that. Most people who come into the hospital are acutely ill, and they leave very soon after, either the same day or the next day. Hardly anyone stays long in the hospital. Patients are discharged sooner. And so with that statistic, we have to have students that know how to go into the home setting and take care of a person. Skilled and specialized nurses are going to be in great demand in the future. And I encourage all my students who are the baccalaureate degree students to go on for a master's degree, and even more than that, and specialize, so that they will be able to find their niche in what they want to do. These are the clinical care realities. There's less inpatient hospital stays. There's increased outpatient surgical procedures. There's more home health care. And there's lots of outpatient nurse practitioner-run clinics. And more, of course, over-the-counter medications. How many have been taken care of by a nurse practitioner? Anyone in here? Yeah, you're starting to see a nurse practitioner before you see a physician these days. And very often, these clinics that we see in the drugstores like Walgreens and CVS, they have nurse-run clinics now, right in the store. Nursing employment statistics are interesting. Registered nurses constitute the largest sector of healthcare providers. About 60% of them are in hospitals. That means 40% are out of hospitals. And where are they going to work? They work, like I said, hospice, home care, insurance companies, drug companies, and other kinds of healthcare organizations. So as a nurse, you're not only going to be limited to hospital-type care in the future. You can actually, study to become other roles in nursing. The employment of registered nurses is expected to grow 26% from 2010 to 2020, faster than the average for all occupations, which is good news since you want to be employed when you get out of school. Within 10 years, 40% of working RNs will be 50 years or older, just like me. We're all coming up to the time when we need new blood. More and more nurses are turning 50 and over and retiring. And so as those RNs retire, the supply of working RNs is projected to be 20% below required. And so this is what we are projecting for the future. Now, how do we prepare current nursing students here? Just to reiterate, we have chemistry and all the liberal arts like English, philosophy, sociology, psychology, etc. Anatomy and physiology, of course. And let me show you how I put some of this anatomy and physiology in my lectures. I use YouTube. YouTube has lots and lots of good learning going on there. This is an example of how I can show a three-dimensional view of the organ system or body area that I want the student to see. I have to put up with these commercials, however, and have to X them out. That's America. But anyway, this is what I can use to put in my lectures. Instead of bringing those models to class, this is what you can do nowadays. And other things. I can maybe show you something else. I want my students to pay attention, so once in a while, I'll throw in a YouTube.
Transcription is the process by which RNA is assembled from a DNA template. The two strands of the DNA double helix are held together by bonds between complementary base pairs. DNA encodes genetic information in the sequence of bases along one strand.
Now, that's just an example of what I do in my lectures to keep it interesting and fresh. Genetics, as you just saw, is a very big part of our curriculum now. You will have a whole course in genetics. We used to split that with microbiology. Not anymore. Genetics is becoming more and more the topic of the future in healthcare. Physical examination, you will examine each other in physical examination, but you'll also examine mannequins, like you see in this slide here too. here's another. Now, what we do with these mannequins is interesting. We computerize them so that we set up abnormal heartbeats, abnormal respiratory kinds of, and different kinds of diseases, so that the student has to take care of an actual case scenario while we, the professors, are watching from another room through a camera. And so it becomes a very real situation for the students because they don't have us with them at their side. And we get to see it, we get to record it, and we get to sit with them and actually critique it with them. So it's really a very good learning tool. Now, where do our students go for these kinds of real clinical practice situations? We have them anywhere from pediatrics to geriatrics. And the pediatric place we go to is Children's Hospital of Philadelphia quite often. The other places we go to is the VA. We also go to the hospital of the University of Pennsylvania very often. We also take them to home health care settings and hospice settings and nursing home settings. Here at Villanova, we're very big on helping the underserved, and our students all have the opportunity to work with the underserved in urban Philadelphia, such as people that are in Ronald McDonald House, Special Olympics, Breast Cancer Run for the Cure. We have encouraged them to volunteer for these different kinds of activities, and professors do it also. And we reach out globally. This is one of our professors in Africa, and we do bring students to Africa to learn about their healthcare needs. And Central America is a very big area that we also go to learn healthcare there. We have a very big ROTC naval contingent on our campus, and we have lots of Navy nurses. But we teach them health policy, we're going to teach them nursing history, of course, Florence Nightingale and everybody involved in nursing from the past, and research. Research is very important. It's evidence-based treatment that we have to teach now. It's very important to have the student actually understand how to do research. And mentoring and advising is done by professors. Your student, your child, or your son or daughter will have an advisor that's part of the faculty, a mentor that's part of the faculty, not a teacher's assistant, not a graduate assistant. Actual professors take on 20 or so students for advisement. And it can be from academics to non-academic subjects, whatever they need. We're kind of in locus, where's that, parentis? Yeah. Lastly, everybody has to know what NCLEX means if you come into nursing. NCLEX is the licensing exam. Not only do we prepare students for the degree, the baccalaureate degree, we have to prepare them for a license. The licensing exam, of course, has many practice questions that we give them from freshman year to senior year. They'll be well versed in the practice questions. And so NCLEX becomes a very important part of preparation in this College of Nursing. Leadership, your students will come out to be leaders, hopefully, and hope that you enjoy coming to Villanova, hope you choose Villanova, and if you have any questions, I'd be happy to answer them now or comments. Did my New York voice come through? No.
You teach the freshman healthcare class, correct?
It's the freshman, I'm sorry, say it
You
again.
teach freshmen, right?
I teach freshmen, I
Okay.
teach
I just wanted to
juniors.
let them all know
Yeah,
that.
I teach freshmen, I teach juniors, and I teach sophomore. I teach, and I teach
Pretty much
seniors.
everything, we
I
all
teach
know.
every single level in this, in this.
But as a freshman, you can have Dr. Kafka.
Yes, you could as a freshman. Glad to see you all.